This week, our script is on scripts. That's right. We're talking about prescription drug plans today here on Health and Retirement.
Are you approaching your golden years? On this show, we're talking all things health, from the doctor's office to the gym and back at home. Welcome to Health in Retirement.
Welcome to Health and Retirement, the weekly talk show with golden advice for your golden years. My name's Trey, Basa, and I'm your host for today, joined by my colleague, Mark Benefiel. Mark, thanks for joining me on the talk show this week. We both are senior healthcare advisors for Market Medicare Advisors. So I just want you to kind of talk about your background a little bit. How did you get into MMA?
Well, I've known about MMA for a number of years, and the core group, market advisor group as well. Been friends with Matt Goolsby, and he continued was telling me about this great opportunity we had to serve others, in this role as a healthcare advisor, and coming from a long time customer service background, long-term sales background, I'm always looking for ways to make an impact on people, especially this part of my career. Maybe when I was younger, maybe I didn't have quite that same yearn to want to help people. So I'm trying to make up for that now.
Better late than never.
Well, there you go. You learn. I'm wiser now.
There you go. I know we've been shooting for a little while. I wanted to make sure that everybody got to know us as advisors. And it's really important before they do come in and talk with us, they have some semblance of what we are as advisors, of people. So I just wanted you to talk about yourself a little bit. But more importantly, I wanted to talk about prescription drug plans today.
Prescription drugs.
So our first segment for today's show is going to be In the Know. Staying in the know with your healthcare and retirement so you can choose with confidence when moving to Medicare. We're talking about prescription drug plans. And we're talking about changes that are coming to PDPs.
Some big changes.
Big changes. And it's always changing year after year. It is an ever-evolving plan for retirees. So I wanted to point out from the Kaiser Family Foundation, the independent source for health policy research, polling, and journalism. They put out an interesting article in beginning February 8th, 2024. And one of the headlines from that was 5 million Medicare Part D enrollees spent $2,000 or more out of pocket on prescription drug plans in at least 1 year between 2012 and 2021. What that means, Mark, is that they are spending $2,000+ out of their own pocket, even with their insurance for their prescription drug plans. I want to talk about how do people get there. Let's talk about the stages of a prescription drug plan and how they get to that spending out of pocket.
Okay.
So first is there are 4 stages. First is the deductible. And that deductible on every prescription drug plan is different.
Right.
Right. Well, the second stage?
Second stage, of course, would be the initial benefit. Which in this year is $5,030, I believe.
5,000 something, yeah.
$5,030, I believe.
And that's the running calculation for you and the insurance company spending money. That is adding up to that $5,000 threshold, and then you get pushed into what used to be known as the donut hole, better known as gap coverage today. And in the gap, people have to spend 25% on their retail cost of drugs. And after that, 25% adds up to what, $8,000? $8,000 out of your own pocket. This year, first year, stage 4 is a $0 copay. But that's after you spend so much money in initial and gap.
Yeah. Now, the problem is a lot of people get stuck between that initial $5,000 and that gap of $8,000, or that catastrophic number of $8,000, and that's called the gap coverage. However, a lot of people still, especially folks who are our clients, will consider it the donut hole, which is an empty space between those two. And what happens with a lot of folks is maybe their drugs are being covered at for them, a reasonable rate that they can afford. But when they get to that gap coverage, that 25%, some of these medications are extremely expensive. And that 25% may be quite a bit more than what they were paying in the initial portion. And it really hits their pocketbook quite hard.
And without sitting down with an advisor and predicting throughout the year when you're picking up scripts, how much it's going to cost, and predicting when you're going to hit those different those stages. That's how you plan to spend
That's one of the beautiful things is that, with the programs that we utilize, and we're able to, plug people's medications at their request, we're able to plug those into the system, and look to see how they're being covered and which company's covering it which way. It can become very, very painful where you may be going along for 4 months and paying what you feel is a reasonable rate. And then all of a sudden May comes along and now you're paying 25% of a drug that costs hundreds and hundreds and hundreds of dollars, and your budget is just blown and you didn't realize they were going to go up, and you didn't know they were going to go up. I'm not sure how people make it day to day without having that knowledge beforehand and know how to plan their budget, especially if they're on a fixed income like a lot of our beneficiaries are.
Right. And when you don't have that advisor to sit down and talk to you about how much money you're going to spend throughout the year, what your scripts are going to cost, it's going to blow your budget out of the water mid-year. It's going to catch you by surprise. And one thing I wanted to highlight with this segment is
big changes right here.
The Inflation Reduction Act.
Listen up, folks over 65.
The Inflation Reduction Act of 22 it was like 400 pages of XYZ taxes, and there was a couple of pages about Medicare. One change.
My representative's still reading it, I think.
It takes a couple years to just thumb through.
Yeah.
One big change that was implemented this year was the $0 copay in stage 4 catastrophic page. But of course, that's after X amount of dollars spent in initial and gap, and then you get to that $0 copay. But coming down the line, I believe it's 2025, there's going to be a maximum out of pocket on prescription drug plans. You still have a deductible to fulfill, and you have to pay at the initial stage and so much at the gap coverage, depending on how much your drugs cost throughout the year and what kind of coverage you get. But the Inflation Reduction Act of 22 is looking to implement a maximum out of pocket for the year on a prescription drug plan. So big changes coming down the line. If you don't have an advisor to meet with, to talk to about these changes, or even explore different plans and options, you should probably get one so you can stay in the know with all of these changes. That's going to wrap up our first segment. Did you have something more?
I was just going to say, I mean, that prescription drugs is something we spend so much time on, and that's the area where we see most of our beneficiaries really spending money that are just not necessary. And to your point of having an advisor who has the ability to look that up and kind of project for you is an incredibly valuable service. We're able to save people thousands and thousands of dollars sometimes over what their current coverages were when they go into a new year, just by taking the time to look those things up.
Yeah, because plans change every year. Mm-hmm. They're not going to be the exact same coverage. And I would agree with the sentiment that prescription drug plans are probably what we focus on the most. When it comes to people moving to Medicare, they have to choose between supplement plans and advantage plans. That's pretty clear cut. People already know, I don't want an advantage plan, sign me up for a supplement plan. I have this company in mind for an advantage plan. But what really defines somebody's Medicare coverage in retirement is their prescription drug plan. Plans that change every year, premiums change, coverage change, and it's really going to be tailored to the individual, what scripts they're on, and possibly what scripts they could be on in the year, how much is going to cost throughout the year.
Absolutely.
Yeah, so that's going to wrap up our first segment, In the Know. If you want to stay in the know with all things Medicare, or perhaps have a professional examine your list of scripts, give us a call at 316-252-8707, or you could start a conversation with us over email, mail@marketmedicareadvisors.com. That's going to push us into our second segment, and it's going to be client case study. We are going to examine one of my clients, Ruth, in Wichita, Kansas. And we're going to talk about Ruth's case and how we would go about somebody that has I'll let you know right now, Ruth has quite a bit of prescription drug needs. Mm-hmm. Looking at her list, longer than my forearm. She has XYZ for every little bit of thing. Now, when people are turning 65 and moving on to Medicare, a lot of doctors see that they're turning 65 and they'll give them something for high blood pressure, cholesterol, a lot of maintenance drugs. Roots has a couple of conditions that develop over time. And I wanted to talk about how we would go about helping somebody that has an extraneous list of scripts. So, Mark, why don't you?
Well,
walk me
that's
through-
a big concern for a lot of folks when they come on to Medicare, and even as their ongoing maintenance while on Medicare, is how are my prescription drugs going to be handled? Because that is where the bulk of the cost comes in for most people. Over above what maybe their budgeted items are for, Part B and whatever they might be at, or whatever type of coverage they decide on, but. At their request, we do have programs we can plug in the drugs that they're taking, the dosages, the frequencies, and it's going to go out on all those different companies that are there, and it's going to look at the published formularies, and it's going to come back. It's going to tell us exactly what the cost of those drugs are going to be. It's going to tell us what tier that they're on. It's going to tell us whether or not whether they're in what type of coverage you're in, whether they're it applies a deductible or the initial gap or initial coverage or gap or catastrophic coverage or whatever it might be. And we can even break it down by months. We can break it down by, January, February, March. We can break it down by tiers. We can break it down a lot of different ways and move things around to ultimately help them find the best cost structure for their budget for the drugs that they have to have.
And that's important information because that plan does not change throughout the year.
Right. Once you're in it, you're in it.
That is the coverage you get. That is the premium you are paying. And if you don't have that idea of what you could be spending throughout the year, and you're not planning, you're not budgeting for those expenditures, it's going to surprise you and it's going to cost you more than you think. One thing that a lot of people don't actually understand about PDPs is that they do have pharmacy networks. Now, they're not as restrictive as Medicare Advantage plans, but those networks work the best with X company, X plan. They get the best rates with this plan at this pharmacy. You have to be careful when you are signing up for a plan and you are looking to fill your list of scripts, because you could go to X pharmacy down the street, and that's a very popular grocer, but just down the road the other way, you have another pharmacy that doesn't work with the same plan,
or even across the street,
or even, oh my goodness, yeah, here in Wichita there are so many pharmacies that are just right next to each other. So if you go to the wrong one, all of a sudden your prescriptions cost more.
And it gets confusing for a lot of seniors because the reality is you can get your drug at any pharmacy you desire to. You tell your doctor to send the prescription over, and you can get it XYZ or MMP or whatever, right? Wherever you want to go. But there are certain pharmacies that work with specific insurance companies where they get your lowest rate. And we can sometimes see thousands of dollars in difference from a preferred pharmacy to a standard pharmacy to a mail order pharmacy in some options. And so sometimes it may be a little bit less convenient for you to go to this other large box store to pick your stuff up as opposed to your boutique neighborhood pharmacy, but it could save you thousands of dollars. And we're able to show what those cost savings are directly in front of you in the systems that we use. So sometimes that means you have to modify. You don't have to modify, but just know you're going to pay a little bit more at your preferred pharmacy, maybe over another one that the insurance company you're working with works directly with.
And you mentioned mail order. A lot, I should say, of prescription drug plans love mail order. Sometimes we see cheaper rates with mail order.
Sometimes considerably cheaper.
But some clients are a little adverse to signing up and using online pharmacies.
And that's another, fallacy, which is I don't have to get everything from mail order. I've had clients that had some maintenance type, statins and things that they're going to have, get a 90-day supply, which is fine. There's another one where there may be a drug that is a little bit more life-threatening if they don't get it on a regular basis, and they choose to get that at a local pharmacy with a smaller supply. So you don't have to go to one pharmacy. You can go to multiples. You can go to multiples and get your drugs at different costs. But it takes some time to work through those with people. But what I take my most satisfaction out of, quite frankly, is showing people how they can save money on things that they have to purchase because from health reasons.
I had a gentleman in my office just last month who was paying $80 for this prescription drug plan. And I sat down and reviewed his list. I said, sir, you don't need this $80 a month prescription drug plan. He had called a number on the television and he talked to a representative who was selling the one company's set of plans and said, hey, sir, this is the best fit for you in this zip code. Where we, as an independent brokerage, we certify with a number of companies. We represent a number of plans that we essentially cherry pick for your list of scripts. We don't represent one company and one set of plans. We want to find the best fit for you in order for you to get the most out of your prescription drug plan and ultimately save some money over the course of the year.
I think my dad said it best. If all you have is a hammer, meaning one plan, everything you see looks like a nail. Right? So it doesn't matter. You're gonna bang on that nail until it goes where you want it to go. And that's unfortunately what a lot of these, companies do. They'll have one plan and they're gonna make it fit one size fits all. And the reality is we look at dozens of different plans, do the numbers, run the numbers. And sometimes it's counterintuitive. Sometimes paying a little bit more for your premium actually gets you less, costs you less in the drugs. And so there's definitely a way to kind of move things around to find the best possible option.
If you have a precarious problem that you want us to talk about here on air, you can schedule your complimentary no obligation consultation today by giving us a call at 316-252-8707, or you could always write to us at mail@marketmedicareadvisors.com, and your question could be featured on air. And that's going to put us into the final segment for today. It's going to be our mailbag segment where we take a question from a viewer and we talk about it here on air. Today's question comes from Angela in Manhattan. And Angela asks, when's the best time to meet with you as an advisor to go over my list of prescriptions? When would you say that best time is, Mark?
Well, as most people realize, there's kind of a 7-month window when you can enroll. And when you wait till that 3 months before your birthday, that's a fine time towards the beginning of that, but it'll definitely make it towards the beginning. We love to have conversations with our folks, 6 months out, maybe even longer, as they're planning, because we're not only looking at what the costs are this year, but we're also looking at what the costs are for the next year in a lot of cases as well. And so when you're planning for retirement, you're planning for the next step, it makes sense to look out, a good 6 months prior to that. It's not uncommon for us to meet a little bit earlier than that, but prescriptions change as well, and so we don't want to go too far out. Then things are going to change, and the cost structure is going to be different, et cetera. So that 3 to 6 month period before you're going to turn 65 is a really good time.
And we don't meet with just people that are approaching Medicare eligibility. We talk with people who are already on Medicare and have their plans set, but they're not set in stone. There's an annual enrollment period every year, October 15th through December 7th, where we talk with Medicare beneficiaries about, hey, what's going on in your life? What's your list of scripts look like? Is there anything coming to the following year that would benefit you better? And we talk about changes in premiums, coverage, and plan availability, and all that stuff every year with our clients, October 15th through December 7th.
Absolutely. And that's really where I get a lot of that satisfaction from, is bringing somebody who's now in their 70s, have been paying for a prescription over years. It's went up. They just figured, well, it just goes up. Everything goes up. Come to find out, they could have been getting it for a lot less from a different provider.
It's important that you sit down with an advisor every year and you go over those changes, because before you know it, plans change and all of a sudden you're just throwing money down the drain, not getting the best coverage for your list of scripts. And I think that's going to wrap it up for today's show. Do you have any final words, final thoughts?
Find somebody who's knowledgeable, who has the proper certifications that can look at your prescriptions. It definitely can save you a lot of money, and at the very least, it'll give you the peace of mind knowing that the plan that you're in is the right one for you, and you don't have to walk around month to month wondering if it's the right one. You'll know visually, this is the right place for me.
Absolutely. Yeah. And that's what we aim to do here at Market Medicare Advisors. We want to give you the peace of mind that you're in the best plan for you, that your plan is a right fit, and it is serving you to the best of its abilities. If you want to ask a question on the show, you can write us an email at marketmedicareadvisors.com, and be sure to give us a name, a city, so we can shout you out on the show, like Angela from Manhattan. And as always, you can give us a call and schedule a meeting with us, 316-252-8707. that's going to be it for today's show. Hey, Mark, thanks for joining me, man.
Welcome.
Really appreciate you coming on. I love talking to you. You always have some great bits from your dad, hammer and nails and whatnot.
Yeah, well, some of those may actually be from him. Some I may just made up and attributed to him.
Giving him some credit. That'll be it for today. Thank you, viewers, for joining us for another episode of Health and Retirement, the weekly talk show with golden advice for your golden years. We'll see you next time.
Unless otherwise indicated, all client and prospect names mentioned on this show have been changed to protect the identities of the individuals discussed. The content provided is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers. This is not endorsed or affiliated with any U.S. government agency, the Social Security Administration, or associated with any federal Medicare program. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. All rights reserved.